This segment is sponsored by White 32 Dental. The DMV can be a stressful place to live, and while stress is associated with emotional and mental health, it can also take a toll on your physical health, including clenching your jaw and grinding your teeth. So here to help us make sure that your dental health doesn't suffer because of your mental health is Dr. Charles White, who is the owner and dentist at White 32 Dental. Welcome back. Great to see you again.
It's good to see you as well. Thanks for having me again.
For sure. I think this is a problem many people can relate to. We have experience.
Absolutely.
Is it the overnight grinding that you're seeing a lot of times, or clenching your jaw because of stress?
I've seen it all. I mean,
Really?
especially in recent times, especially in the DMV. I mean, you see a lot of people. There's been a huge uptick in the number of people who are actually experiencing some TMJ-related issues.
Yeah.
So it's
Okay.
been a big deal.
We want to dive into that today. So we know you as a cosmetic comprehensive dentist. You also have a specialization and special training in TMD, which we always call TMJ.
Yeah.
What is the difference?
Yeah, so TMJ is actually temporomandibular joint. So it's actually just the joint that this is mainly referring to.
Oh, interesting.
Now, so a lot of people say like, oh, I have TMJ. Well, we all have TMJ. You know?
We all have the joint.
We all have the joint,
Okay, okay.
exactly. But TMD, which is temporomandibular disorder, is actually any sort of issues associated with not just the joint, but anything associated around the joint. So the muscles, the nerves, the joint itself. So yeah, that's really what TMD is really related to.
Okay, and you see a lot of patients for this. What are some of the symptoms when they're coming in? What do they tell you is going on that they're experiencing?
Yeah, what's actually is interesting about that, a lot of people don't even realize that they have any sort of TMD.
Really?
Yeah, and so a lot of times people will come in and the dentist will ask them like, oh, are you grinding your teeth? Or like, it looks like you're grinding your teeth, and people are taken back by that.
Really?
But the people who do come in and have symptoms though, typically speaking, you hear like them talk about clicking, popping in the joint whenever they're opening or closing their joints, open and closing their mouth rather. Sometimes headaches. Tension in the muscle here. A lot of people actually come in because they have ear pain. We get a lot of referrals from ENTs and audiologists because they think that there's actually like an issue with their hearing, but really it's actually they're having like a fullness in the ear or the underwater feeling because of TMJ. Or TMD, excuse me.
Yes.
I made the mistake myself.
No, but it's what we always say,
Exactly,
right, when we're talking
because
to you
of
about
TMD.
it. I've noticed before, like my retainer will be grinded down a little bit. I'm like, oh, I'm grinding my teeth overnight.
Exactly. It's a good litmus test to see whether or not you're actually doing it.
Because you don't realize it. Okay, what's the first thing you need to do? If you are experiencing these symptoms, how do you go about fixing it?
Yeah, the first thing I want you to do is you got to go see your dentist.
Okay.
Because ultimately speaking, like the dentist a lot of times is going to be the one who's going to be able to actually treat you. We do a lot of TMD related, like a lot of TMD appliances, and do a lot of different types of TMD therapy. But you got to go see your dentist though, absolutely, because here's the issue is that a lot of times that it becomes a little bit more difficult to manage the longer it goes on. Think about running the marathon. I mean, that's kind of what you're doing all day, all night when you're grinding and clenching your teeth. So you got to make sure that you go see your dentist. Make sure that they, they get the proper diagnostics and they get you treated, because that's a hard thing to manage if it gets really severe.
Is it as severe as surgery eventually? But it could
can
be solved with a mouth guard.
It can be. Surgery is not a great option, but it is unfortunately sometimes the only option for a lot of people. So we just don't want you to get to that point.
Don't wait.
Prevention is absolutely the key in this particular case.
There's many steps before you would have to do surgery.
And I get it. We're all stressed. We all got things going on, but you got to prioritize your health because you don't want to do it. You don't want it to be too late.
Do you have any quick story of a patient who has come in?
I do actually. So we had a young lady who actually had been suffering with TMD for 25 years plus. Was not able to get any help, tried different things, and basically within 90 days of her being in our office, she actually experienced some relief that she had never had before, and she's just completely changed personality. It's amazing what chronic pain will do to you, and then once you get that relief, she just totally changed her personality. She like asked for a job at our office.
Oh, really?
It was funny. She's one of our favorites. But
doesn't that make you feel good?
Yeah, it does.
I mean, this is impacting us every day, whether we know it or not.
Exactly. And it's one of those things as well where, like I said, the sooner that you can diagnose it, the sooner that you get it treated, the better.
Okay. Thank you. I feel like so many people will relate. If you want to learn more, or maybe you need to schedule your appointment today, just give Dr. White a call. You can call him at 240-221-6608. Again, it's 240-221-6608. Or you can also go to white32dc.com.